A high-frequency linear transducer with a musculoskeletal or superficial exam type is used for the ultrasound examination. This exam may be optimized by having the patient's head midline in neutral position with the spine. Examination of the airway for endotracheal tube cuff location can occur during placement or after the endotracheal tube has been placed in the trachea. The fundamental principle of the examination is to adjust the ultrasound plane to examine the trachea from the level of the sternal notch to the thyroid cartilage and assess for dilation of the anterior aspect of the trachea with endotracheal tube cuff inflation. Using a transverse plane and with the orientation marker directed to the patient's right side, the transducer is placed on the anterior aspect of the neck just superior to the sternal notch. The examination should begin with the transducer sliding cephalad from the sternal notch to the thyroid cartilage. During the examination, the sonographer should obtain assistance with inflation and deflation of the endotracheal tube cuff. The sonographer will examine for dilation and deformation in shape to the anterior aspect of the trachea during the scanning procedure. Review of the transverse cross-section ultrasound image will show hyperechoic half-circular structures, which represent the anterior cartilaginous part of the trachea. Alternatively, placement of the footprint of the ultrasound transducer longitudinally from the base of the cricoid cartilage to the distal trachea is another approach to assess the impact of the inflation and deflation of the endotracheal tube on the airway. In the longitudinal view, you can identify the circular tracheal rings followed by the more anterior and ellipsoidal-shaped cricoid cartilage as you scan in the cephalad direction. This is followed by the cricothyroid membrane and the thyroid cartilage. Visualization of the cricothyroid membrane is most optimal in the longitudinal cross-section. Additional scanning techniques that can be useful for identification of the appropriate location of the endotracheal tube is verification of bilateral lung expansion. This can be assessed by ultrasound by evaluating for the presence of the lung sliding sign. Further details of this examination are highlighted in a separate module.